Katie, what's wrong?
Just everything hurts.
Everything hurts? Oh my goodness. There's like no one in here that is helping or coming by. This is ridiculous.
Come in.
Hi.
Oh,
Hi, you must be Katie.
Katie, say hi.
That's okay. My name is Kimberly. I'm here with social work.
Hi.
Hi. It's nice to meet you. I wish it was under different circumstances. May I come into your room, Katie?
Can she come in, Katie? Is it okay?
Yes.
Yeah?
Thank
Okay.
you. I appreciate
okay.
that. Sure. May I sit in this chair beside you, Katie?
Sure.
Sure. Thank you. So like I said, my name is Kimberly. I'm here with social work.
Thank goodness.
Yeah?
Yeah.
I'm actually a graduate student. I just want to let you know that.
Oh.
So I'm here until April. I know we're December now, so that gives us some time together. And basically, I'm here to be as helpful as you need me to be, as I can possibly be for your family. And that may mean a lot, and that might mean on other days not very much. And I respect that as well. So
We're just looking honestly for more information. Like there's nurses, there's doctors, they're going everywhere, in and out. Like she's not feeling too comfortable with like people coming in at unpredictable times. We're not sure. Like she needs we need structure and we need more information. Like we're not getting anything. Like, I don't know. I'm not even clear about what's going on.
How many days have you been here now?
I'd say a few, about 3 days.
Yeah.
Yeah, it's been a long 3 days.
Yeah. I do have a little information. I'll let you know that. I know days can kind of all come together when you're in here. So I just wondering if you knew how many days you've been here. Did you realize that, Katie?
What?
How many days you've been here?
I don't know.
Can we count? Can we count together? How many? Since a few days ago, right?
2?
2 or 3? Yep.
Yeah.
3.
Yeah.
Okay.
That's really good. And you must be Katie's father?
Yes.
Dean,
Dean.
is it?
Yes. Nice to meet you.
Nice to meet you too, Dean. And I know we've already started speaking a little bit, and you must be Gabby?
Yes.
Yeah. And if I'm not mistaken, that you also have a son. Katie, you have a brother?
Yeah, I have a bro.
Where is he right now?
Hockey, maybe?
Yeah, he's at hockey. He plays AAA.
Oh,
AAA
wow.
hockey. Yep, we're pretty busy with him.
Yeah.
I'm at home with him, taking him to school,
Okay.
and then I've been coming here as often as I can, but primarily taking care of Katie's brother.
It's tough. Like I barely see my son.
Yeah.
Like, and I feel like I need to be here for her. Like, 24/7. Like I want to know, what's going on with her. Obviously, right? Like I feel like I'm entitled to that information. This is not an easy thing to go through, and I know, sometimes I get a little controlling, but it's a serious thing. Like, and the doctors at first, we were admitted and it was fine, but now it's like, it's difficult. Like we have so many people coming in, and it's just a bit much.
Can you take me back to when you first came in and what you understand? Katie, do you understand why you're here?
I'm sick, I guess.
And do you understand what you're sick with?
Kind of.
Can you tell me a bit more about that?
Something's wrong with my blood.
Something's wrong with your blood.
Yeah, we've gone through a lot of things. So basically, there's some sort of cancer diagnosis. Our son actually says it's the good kind, but I'm not really sure about that. I just, it's still pretty serious. Like not exactly what we saw coming.
Was your son here when Katie was first admitted?
Yeah, he's come in a few times, just
I bring
when
in
they've been
vacation.
able to. Yeah, like they're also super busy. I haven't been able to go on one school trip this year, but like husband's been amazing. He's been going everywhere.
We also have a dog at home.
Yeah.
Yeah, Blue.
Yeah. She really loves Blue. Blue's
Yeah, I see you really lit up when your dad mentioned Blue.
I wish Blue was here right now.
Yeah. If we could have Blue in here, it would probably make things so much better for I think all of us.
And I see one of your stuffed animals is a dog.
Yeah, it reminds me of Blue's.
Yeah? Is that what Blue looks like?
Yeah, he's a golden retriever.
Mm-hmm.
Yeah.
And
He's
so,
a really good dog.
and is Blue your dog?
Our family's dog, yeah.
Mhm. He's I think more there for her, for everybody in a therapy kind of sense, actually.
So that must be quite hard being away from him then.
He's my best buddy.
Yeah.
Of course.
Maybe we can set up a Skype meeting with Blue. Would you like to do that?
Yeah,
Like I can see.
we can do
Blue.
that.
We can do that. If you
Wow.
have a laptop at home, we
Mhm.
could set up a meeting. Would you like to see
That'd
Skype
be so cool.
Yeah?
Yeah, that'd be so cool.
Is that something that you're able to do?
Would you be able
Yeah.
to do that?
Yeah, I think I can.
Would it be too much, like in here, or?
Not at all.
Okay.
Not at all. We have access to technology equipment through, I'll go over some of the services that we do have.
Yeah.
I know you mentioned there's a lot of people coming in, and
Yeah.
that's the hospital, and there's a lack of privacy.
Yeah.
It's hard. You're here. You have.
It's just
another
they're coming
side
in
of
at
them.
all times, and it's just we had this one interaction, and she really doesn't like it when they come in unannounced.
Okay.
So if they're gonna come in at 9, they're gonna come in at 9, not 9:01, not 9:02.
Okay.
We need them to be here at 9.
Okay.
The other day, something happened with nurses, and it was just like it was way too much. Like
Okay.
they started coming in. Katie obviously getting super upset because like we didn't know all of these people. She doesn't know the nurses that are coming in. Like
Absolutely.
it would just be so much better if they would work with us a little bit more than just coming unannounced. Like people that we don't know, nurses that don't know her case, they're just coming in, checking her blood and leaving. Like I don't get to know about what's happening.
Okay.
Like what are you checking all the time on these charts?
It sounds like you need. It would be helpful to have a bit more information behind all the different procedures that
Yeah.
they're doing with
Yeah,
Katie.
they're just sticking needles in her and stuff. Like that's not okay.
I hate it.
Yeah.
Yeah.
I hate it.
What would be helpful for you, Katie, when the nurses come in? Is there something that would be helpful?
Well, I don't know. I mean, if they promise to come at 9, they should come at 9. You know.
Okay. And if they're not able to come at 9, then probably not make that promise.
Like we just
Yeah.
want to know what's happening before it happens. Like especially with what's going on, it would just be super helpful if people would maybe come to me first,
Okay.
and then let me talk to Katie, and then like we can set something up.
Okay. So no doubt both of you are the expert in your children's lives. We're here, and the circumstances, we wish they were other circumstances, but we're here to journey alongside you as best as we can. But we do definitely, I respect that you are the expert and know your children best. And so we can set up a meeting if you think that would be helpful with some of the key staff that are in charge on this unit to hopefully come together and at least have a few approaches that would work best for
I'm not sure how
Katie.
much I could like leave Katie though. I feel
Okay.
like it's gonna be difficult. Like I'm always here for her.
Okay, so we could even meet and you could even let me know what parts would be most important, that you feel are most important for the medical team to hear, and I could advocate on your behalf in the meeting if that would be more comfortable for you.
Does that sound okay, Katie?
Sure.
Yeah.
If it makes the nurses keep their promises, because I really don't like it.
Yeah.
And I understand because we are a teaching hospital, there's a lot of turnover, a lot of new faces,
Yeah.
and it sounds like that's
Yeah, and like I wasn't even present for the first part of like the assessment with the medical team. They started without me, and I was just like, "What is going on?" I wasn't even there.
Okay. Where were you when that happened?
I think I was out getting something for Kate. I think I was out getting her food or something like that. And I
Okay.
come in, and all these people are around her, and I'm just like, "Why would you start without me? Like I'm her mother. I should know exactly what's going on."
Yeah, Dean, I see you shaking your head. Were you able to be present at that meeting?
No, I was with her brother at that
Okay.
time, so I wasn't
Yeah.
present either. And I was curious to hear that that's what happened.
And it's hard because I want to be at home too doing these things, and I know that like you're obviously more than capable of staying at home holding down the fort, but like I'm both of their moms, right? And it just makes me very anxious to know that like my son needs me and I'm not there for him either. But
It sounds like it's very painful to have to be separated and devote your time with one child who definitely needs you now and another child who you know needs you as well, and you're not able to be there in the way you would like to be for him right now. But it's
Like, I don't think I've been to one hockey game.
I
This
think we're
season.
doing the best that we can.
I wish
Yeah.
I could go to a hockey game.
I know.
I love hockey.
Mm-hmm.
Do you play hockey as well, Katie?
No, I'm too sick.
Before you were in the hospital, did you play hockey?
A little bit, yeah.
Here and there.
Yeah.
Mm-hmm.
Yeah. She's only 12, so.
Yeah.
Yeah.
And I understand, I know there's a lot of information being probably passed to you or not passed to you, but a lot of
Yeah.
things happening.
Yeah.
So I hope we can meet in a few sessions. So I don't want to overwhelm you with too much information.
Yeah.
There are a few pieces of information I'd like just to cover with you so I can hopefully best help you.
Mm. Well,
when I
Kate, we're
address
here for
the
Katie
team.
too. Like,
Yeah.
it's, I know, like, we're a part of it, and I would like to know everything, but relaying the information to Katie is going to be, like, a top priority.
Absolutely.
Because she has, like, a lot of needs, right? And I'm just going to, like, point blank say that. Like, she has certain things she likes, certain things she doesn't, and we need to make that known.
Can you let me know some of the things she likes and doesn't
So
like?
we noticed, like, the timing and the unpredictability. Like, there needs to be a plan set in place.
Okay.
As well, like, which service is coming in. So I
Okay.
can mentally prepare her. Like, if there's going to be blood taken, we're going to need some time to talk about what that looks like. And we're going to have to talk about it, right, Katie? Like, it's not necessarily a good thing for her to be just, like, poked. Like,
Absolutely.
you know?
Yeah, I
So-
don't want some random woman coming in.
Yeah, and that's the thing, too.
Sticking needle in you.
Randomness. There's so many random people.
Okay.
And I don't think Katie likes it when people are coming in and she's like, oh, who is this new face? Like,
Right.
that one time when all those nurses came in and it was just like, we don't know any of you. Like, Katie
Mhm.
did not like that. It was not good.
What happens when people just come in, Katie?
Hate it.
Are you able to talk with them? Do you hide from them? Sometimes some of the kids I work with don't like it either, and they hide from the nurses. They'll
Well, they
cover
just
their face
assume
with
that they
the
know what she
blankets.
wants. Like,
Mhm.
they don't know. They don't know anything about her.
And it sounds like you right now part of your treatment. Nurses will need to take some blood and take your vital signs, which means your blood pressure, your temperature, and the way that
That's
It sounds
fair.
like-
It's
Yeah.
Katie and understanding, like, this is my nurse. I think, developing some sort of relationship, like, with
Consistency
Katie.
would
Yes.
be very.
Yes.
okay,
We want consistency and
okay.
Mm-hmm. And, like, she doesn't want to tell them no. They're doctors. Like,
Sounds
I
like
wouldn't want to tell them no either. Like, but I know that they know what they're doing, but it's just, like, it's a lot.
Mhm. Sounds like you've raised a very respectful and polite daughter. Yeah.
Yeah.
Katie. Do you mind if I take a couple notes while we
Yeah,
meet?
for
Is
sure.
that okay, Katie? Because this is a lot of important, to me, it's very important information. It has to do with you and your body and your life. And I want to make sure when I meet with the team, I tell them accurately exactly what things they need to know about.
Mhm.
Would that be okay?
Yeah.
Okay.
I don't care.
So I'm just going to jot down a few things that you've
Yeah.
already mentioned to me about the unpredictability, need for consistency. You mentioned
Mhm.
Dean. Okay. And you, prior to that, I heard you mention that you understand she has a type of cancer, and
Yeah.
it's the good kind.
Yeah.
Can you tell me more
Yeah.
about that?
I don't even remember what they said. Like, I don't remember the kind of cancer that it was. It was just a whole lot, and, like,
That's-
hearing that your
yeah.
kid has cancer is, like,
Mhm.
I'm not exactly listening to all the details.
That's-
Right, it's just, yeah, it was just a lot.
Mhm.
We had these certain expectations about what Sick Kids was all about, and,
Okay.
what we were here to do, and then just the shifting, and, like, it's just been a chaotic experience in general.
we don't know how long we're going to be here for. And
Mhm.
I also have questions about finances and
Okay.
because
Yeah.
I'm commuting
Yeah.
and taking care of her brother and
Between, like, our finances, just the
Mhm.
logistics of everything,
Just-
just everything, like, I am legitimately in crisis mode.
Okay.
Like, I don't know which way is up. All I know is, like, keeping Katie, tended to, like, giving her everything that I can. But it's also just been, like, I'm burnt out.
That's exhausting.
Yeah.
Sounds exhausting. And that's definitely in this abnormal situation, a normal experience when
Yeah.
you have a team telling you a diagnosis, such as a type of cancer, then the ears just turn off, and everything's a blur.
Legitimate tunnel vision. Like it was just, what's the best thing for Katie?
Okay. Would it be helpful if the medical team, and not a huge team, maybe one doctor, and maybe Child Life Service, which is a service I think could be helpful for you, Katie, and they're pretty darn cool people, if I say so myself, came in and went over her diagnosis with you and provided a bit more information around what it looks like, just the length of stay.
What do we need to prepare here for?
Okay.
Like how much, I'm like, how much money is this gonna like cost us, and what supports do we get? Like, it's just what do we do?
Yeah. And what supports do you have in your lives?
Well, the community has been like amazing. We heard about this whole GoFundMe page thing, and we started that up. But like with that response though, like we also don't qualify for like other things that it's still not enough. I don't feel like. Don't know.
And I've asked my supervisor at work,
I'm
a staff sergeant, and about what they can do in terms of me taking time off work. They're getting back to me on that. But
there's this POGO thing that we've been hearing about.
I'm curious to know, it sounds like you know of some of the services we have, and some
like people have been talking to us about some things, and it's just like bits and pieces, just shouting like jargon at us that it's like, okay, can we actually sit down and think, like, we don't know what this entails. It's just like, oh, you need to sign up for this and this and that. It's just like, hey,
I feel overwhelmed just hearing you share that, so I can't even imagine being in your place.
And then all of this while trying to take care of our son, and then like being with Katie. Like, when am I supposed to like apply for all of these things if I need to be here?
And are you sleeping, eating?
Barely.
That's something else that hopefully in the next little while, when we meet together over the course of this week,
it's hard to know like when we're going to be able to do those things, just because like it's hard to know, when Katie's going to need me.
Right. So if I can answer a few of those questions, there is something called POGO, and I did bring you a little brochure about that that you can keep with you when. And if you feel able to read it, no pressure. I know it's probably hard to concentrate and read right now.
Yeah.
And I will briefly describe. So POGO stands for the Pediatric Oncology Group of Ontario. And they offer services, programs, and some of the service that they offer to all our families in oncology and the cancer unit is assistance, some reimbursements financially. And that has nothing to do with income level, taxes. It's specifically money that has been donated and that is utilized for patients, pediatric patients, so patients 0 to 18 with a cancer diagnosis. So today, before I leave, I would like to register you for that. It's not an enormous amount of money, but it does, for each day that, Katie, that you're here in the hospital, you do get it's $15 a day when she's in the hospital. Plus, there's money that can be allocated towards babysitting or caregiving, which could be helpful for Brad if there's days that you need to be here or hire somebody. Who helps watch Brad right now?
It's basically all him.
Yeah. Do you have extended family that?
We do.
They kind of live far.
Yeah.
It's quite the commute for them as well.
And we just don't know what to tell them in terms of what we're going to need.
Okay.
Yeah.
So
which can be hard to know on a day-to-day basis. And with Katie's diagnosis. Have you had any cancer in your family before?
Maybe, I'm not sure. Maybe like down the line. I think my like great grandmother had it.
Not like
this. Is not like this. This, they were older when they got it. It's, I don't know, just a little. I'm not gonna say it's easier, because it's not. It's a terrible diagnosis, of course, but like just having to go through this with my 12-year-old daughter, like.
Is she falling asleep?
Yeah, maybe she's taking a little nap.
I know some of the medications can
Yeah.
make it quite sleepy
Yeah,
at first.
yeah.
Yeah.
Getting used to that has been hard, eh? Yeah.
Katie, do you find it helpful when I talk with you directly or when I talk to your parents right now?
I don't really want to talk right now, so.
That's okay. Yeah.
Okay, sure. Thank you.
Thank
for
you
your
for
honesty.
asking, though. Like,
Yeah.
some people just come in here and they just talk at her and they don't even know if she's paying attention. And, like, yeah.
Yeah, it's, to me, Katie, we're all here for Katie, and you said that yourself. And and yes, Katie is the one in the hospital and the patient, but to us, the whole family is important.
Yeah.
And Katie's at the center of that importance, right? So we recognize that there's often other children as well, and you have your other son, Brad, right? So in trying to support Katie means trying to support your whole family. And that's the approach that we try to utilize here as much as we can.
Yeah.
And if that hasn't been your experience, I do apologize on behalf of the hospital.
Yeah.
And we'll be sure to address that with the medical team. And see if moving forward that we can do things differently that work better for your family and to help take down some, at least a little bit of the stress that you're facing right now. That's added stress that is not helpful
It's
right
just
now.
like in our family, like I'm the mom. I need to be taking care of my children and my family, and it's been so hard to do that. Like that's the way our culture is. Like, you know, mom, dad, like we are a team, but like I always have to, like I feel like I always have to be there. Like my mom was there for me, and like her, like it's just a very like I'm the mom, right? I need to know what's going on at all times. Like I should know.
Sounds like a lot of pressure on your shoulders.
Yeah.
And this is how your family. This is how your family. It sounds like it's been working. So far,
It's definitely been tough though.
It sounds tiring, to be honest. If I put myself in your shoes, and I see your husband's here, and have you been? You're married, yeah. Have you been married a long time?
Yeah, 20 something years.
Yeah.
She's the expert.
She's the expert.
Yeah, I try. I try.
You do sound very knowledgeable, and I'm sure you mentioned you were in social work.
I'm finishing up my BSW, so like having another social worker to work with has actually been super helpful, and I've been learning a little bit about health and what we do in this kind of capacity, but being in it has been a whole other story.
Absolutely. It's one thing to work on the professional side of health, and another to have a member in your family. And even I risk to say, but even more when it's your child. I have no doubt you would change places with her in an instant.
And also keeping in mind, like, we have another son too. Like, how is this normal for him to like not have his mom there? Like,
and it sounds. I can empathize with that, but it also sounds like Dean is trying to keep things normal for him by commuting every day from Stouffville. What is that, like 2 hours, 2.5 hours?
It's quite a commute, but it's important that we.
But it's just like the little things. Like I used to make his lunch for him every day. Like I made the kids' lunches all the time. Like in the morning before I went to work. Like it's just these normal routines that are like in our family, and now all of that is just like it's kind of upside down.
Yeah.
And how does that make you feel when you said upside down?
It's just like things have, you know, we had a way of doing things like in our family.
Okay.
You know, every morning, I'd get up, make their lunches, drive them to school. He would go off to work. I would go off to school and work, come home, like make sure the kids, you know, got to their after school, activities. And now it's just like all of that feels a little discombobulated.
Absolutely. I mean, it sounds like you had this routine, this normal way of doing life, and now a bomb has been literally dropped, and it's about readapting and finding a new sense of what's normal and a new routine in this situation.
And normal.
I hope in getting to know you, I can help to
Yeah.
guide you maybe along that way. And I believe you're the expert in your life as well.
Mm-hmm.
So you will tell me, I have no doubt, what
Yes.
is helpful and what is not
I will be mindful of how I tell you things, because
okay.
sometimes, like, it's just, you know, you got to make certain decisions for, like, your kids. You have to lay down some boundaries.
If I can say, it sounds like, you know, Brad is off at hockey, so
Yeah.
somehow there's still an aspect that's
Yeah.
working.
Yeah.
Even
But, like, where do we go from here? Like,
okay.
I'm not sure. You know, she's been in bed for 3 days. Like, what's going on? What's happening?
Okay, so that's not abnormal in the first stage of treatment. In terms of answering medical questions, we like that to be the medical team, but I can share that the diagnosis they did give was B-cell acute lymphoblastic leukemia.
Right.
They gave,
Do you remember that?
yeah, that sounds familiar.
Sounds familiar. Yeah, I knew there was a couple letters in there.
Yeah.
And
And so this phase is called primary induction.
Okay.
And
so what is, like, our number one thing, like, moving forward? Like, our number one priority is making sure that her needs are met, and that people are communicating with her in the way that she needs.
So medically, her treatment with this diagnosis and this stage of treatment usually involves being in the hospital approximately 2 weeks, and that can shift from 1 to 4 depending, because every child's different, right?
Yeah.
So unfortunately, it is very much day by day, and I know that can be difficult.
That's been the difficult part. Yeah,
right?
like, not knowing.
Uncertainty is unfortunately what is predictable.
So what are some certain things that you can tell me, just to, like, ease my mind here?
Yeah, so some certain things I can tell you is that I will be, once I leave here today, I will be scheduling a case conference with Katie's medical team.
Okay.
Before the case conference, I will meet with you and Katie.
Is that okay, Katie? We're going to meet with some people soon.
As long as they tell me when they're going to come and come at that time.
Okay, I will make sure that.
Yes, because we also want to let her know what's going on. It's not fair to be told things from, you know, other people when you don't understand. So, and I know probably everything there is to know, obviously, about my child. I know how to tell her these certain things, and in a way that she'll understand. So, yeah.
And so you're very, very doting to your daughter and have so much information that would be so helpful for our team.
Yeah.
And helpful, hopefully, for Katie to make this experience a little bit less unpleasant as possible. So I will be meeting with you before I meet with the team to make sure I tell them everything that is essential for them to know. I would like, Katie, is it okay if I talk to my friend Ryan, who's a child life specialist? She has a lot of cool dolls and toys, and she doesn't really like to talk to people like me because I'm older. She really loves to come and hang out with kids. And sometimes she gets bored and just needs to play games with kids. And some of the games have to do with what's happening medically, and there's specific games to help you understand that.
So what was her title again?
Child life specialist.
Okay.
Mm-hmm.
Is that okay?
Is she
a
nice lady?
She's really nice, and I'll be honest with you, if I could, I would spend most of my time hanging out with her because she's so fun, and she's so nice, and she gets kids.
Yeah. Okay.
She gets kids. She lives, eats, breathes kids. Not
We can
literally, eats
do
them.
Do that together then. That sounds good.
Would you like to meet with her? She meets with all the kids on this unit.
Sure, if she's nice.
If they want to.
If she's nice.
Do you have a certain time in mind that you'd want to see them?
Maybe after I eat my lunch.
After lunch? Okay.
After lunch.
Okay.
So what I will say, I won't promise that she can come today after lunch, but I will make sure that I get back to you with the day that she tells me she can come see you. Okay?
Okay.
And
just make sure she comes at the right time.
I will let her know that the time she said she has to come at that time. Otherwise, don't say what time you're coming.
Honestly, that's really all we're asking for, and I'm really happy that you understand that.
So I recognize that, Katie, you mentioned lunch, and I think when I walked in, you were about to go get her some lunch.
Yeah.
So I would like to just fill this out with you quickly. So, Katie, this is some boring adult things that deal with money that I will fill out with your parents. Is that okay? I just wanted you to see what the form looks like. Okay? So I'll just come over here.
I can go get Katie lunch.
Okay.
Would you like something?
Yeah, I don't think I've eaten today yet.
And water. Water's important.
Okay, I'll go get that.
Oh, thank you,
Thank
Dee.
you.
It was nice to meet you.
You're okay if I fill this out with your wife?
Yes.
Yeah?
Thank you.
Oh, you're welcome, Dee. Okay, so here's the POGO form, and you would just put your name, Katie's date of birth, your address, email, and then here on this chart, you just put the dates that Katie's inpatient, outpatient, tally it up, and then the grand total goes here.
Okay.
The next steps after that, we will not cover today because I think that's just too much information.
Yeah, this sounds good.
Yeah.
Okay.
So do you want us to fill it together? Do you want me to leave it with you and pop
You can
back?
leave it with me, yep. And
I'll pop back before 5 o'clock today. Oh, is that okay, Katie? So I can pick up this form from your mom?
I'll be around, so you can let me know, and then I'll talk to you.
It will be before 5 o'clock
Yeah,
today.
okay.
So I'll leave that with you. I'll also leave you my... Oh no, I had a card. Here it is.
Okay.
And I'll leave you my card.
Okay.
So the best way to reach me is on the pager number on my card.
Okay.
Because I'm often on the unit, and I will get back to you as soon as I can. Usually that's within 5 minutes. Okay.
Thank you.
Is there anything else we didn't cover today that you feel would be important moving forward?
No, I think this was great. We got some concrete things at least down. So
Okay.
good.
And if there are any situations where you feel it's not helpful, please do call me, and I will make myself available as much as possible. Come see you and work with the team. Okay.
Great. Thank you.
Okay.
Okay.